All right, you're live.
All right, guys. Hi, how are you? It's Filler Friday, and we're in Dr. Emer's office, West Hollywood, and we have a great patient of mine, very sweet. We're doing some facial contouring today, and here's the thing: when we have young patients that already look good, you don't need to do that much. But you know, my young moms, my working women, they're always like a lot is being taken out of them with hormones, with periods, with life. So their face starts to get a little bit of sagginess in the 35 to 45 range. And we can use fillers to give some facial shaping that gets lost a lot of times from hormones and stress. We're using fillers today to contour the lateral cheek area. I'm just gonna do a slight dab to the temple area. We call this the Auger curve. And so for example, right now, what I'm doing is when you have a longer face, I'm gonna go to the needle. When you have a longer face, and then you have a little laxity that starts to happen as we age, you then lose the definition. So to give the definition back, we do cannula injections deep along the bone and into the fat pads. And now I come a little more superficial to give some definition. This is the combination treatment, because as we age, you also lose some fat pads around the eye. So this really helps. And then I just do a slight bit into the temple area, sorry, a little pinch there. This helps elevate the brow and balance out the improvement that she's gonna get in the cheek area. And if you go into the right area there, look, literally no bleeding. And you can see even in one syringe, we already have a nice elevation in both locations. So we're gonna switch now to the other side. Go ahead and hold there for me. Need the next syringe. Thank you. Okay, turn this way. And we're gonna use a technique where we follow the lateral contour. And this is what most sort of makeup artists do. You know, they're very good at enhancing facial features with shadows, with different colors. I'm using fillers to do that, following along her natural course of where her bone is, but also her natural smile. We're going into the deep cheek fat pads, okay? And just a very subtle bit to give lifting. Here we're using Restylane Defyne, which is a nice lifting product, but also the interesting thing about the way in which new Restylane is made, old Restylane looks like little Dippin' Dots. It looks like little particles inside the gel. So you can sometimes feel it a little bit. We call it a particulate filler. The new Restylane looks more like Jello. It has the ability to move with your face, so it's not going to migrate and it's not going to form lumps and bumps. Also lasts a little longer. So, you know, for patients of mine that fly in that I don't get to see as often, they will get a little bit more longevity. Okay, so we're just, again, following that lateral contour. I feel where her bone is. I feel where the apple of the cheek is. I just want to get her a nice lift. You don't need a ton of product to do this, but you need, I always tell people you need enough. I had someone yesterday wanted 0.2 into the cheek. I said no, because it's not going to do anything. You know, it's not going to really do anything. Right now, we're just doing enhancement, and what you can do, if you look above the top, we can see a nice Auger curve. That's the area of beauty that people subliminally notice. We're going now a little bit deeper to give some lateral projection. Also help the lateral eye area. And then again, we're gonna go directly into that temple for a brow lift, all the way down. This will balance out. What we did with the cheek. How's the pain level?
Oh, it's minimal.
Hold here. Quick, hold right there. Good, good. And watch the cheek. Sometimes you get a little bit of bleeding in the temple area, so we be a little cautious. Now we're gonna move over to the chin. Let's watch her cheek and everything. So we have a nice little elevation here. Actually, I'm gonna do a little bit more balancing the cheek. So now we have that lateral contour. Smile for me. What I wanna do is give her a little bit, just a little, for projection and elevation of the cheek. She has a nice volume here, but we're gonna balance what we've done. Okay, perfect, one more. now what I'm going to do is turn your head to the left a little bit. We have that lifting here. Look up a little bit. We're going to follow her jawline right here. You see the edge of her jawline. We're just going to give her a little bit of projection here to balance out what we just did in her cheek so that she has a little more definition, because you know, as we age, this area becomes a little looser. Okay, you can see here now, we gave her a little more structure. You can see that 90-degree angle. When we go to the other side, just going to do a teeny bit more there, and then we're going to go to the other side. The other thing I always teach when we're doing the jawline, if you feel for the back of the jawline, you go right on that bone, okay? But we also go in a 45-degree angle upward to give that 90-degree projection. Perfect, and that's a good starting point to give her some contour. Let's go to the other side. Again, follow the jawline right at the edge of her mandible, base of the mandible. Give a nice little projection there. Okay, what's nice about the Restylane products, we can mold them very nicely. Okay, good, so we have a nice little there. And then again, to balance out that beautiful height, we're gonna go right to the apple of the cheek. Just do a little bit for lifting. Perfect. Now, the other thing I talk about when we do contouring needle is the chin.
Another
Needle is the chin area. And for her, we're just gonna give some projection and softening of the marionette area. We've done lateral lifting, we've done shaping in the jaw. It looks freaking phenomenal, excuse me, everybody. Just got excited there. We're gonna do a little injection, center all the way down, nice and soft. Well, for her, we don't want to go wide, we just want to project. Just to bring it forward so that we see that angled look. Perfect. And then just a little to the angle of the mandible, nothing, sorry, the angle of the marionette area. You don't want to overdo it there. Go to the other side. This is like doing an implant. And we're just following exactly where we would on a jawline. Again, following just a little bit in the marionette, not overdoing it, giving her that projection. And then the last thing I want to do for her is use a newer filler called Prolinium, Revenes Versa, made by a company Prolinium, that helps soften lines, and I like it because this is the only pre-hydrated filler in the United States, meaning that when it goes into the tissue, it does not absorb water. It goes in, it's space occupying, that's it. So what you see is pretty much what you get, and patients love it because it's very softening. So in fine lines, under eyes, chin crease, which is what we're gonna do now, just give her that little extra bit, soften everything. Remember, we just did the foundation filling. Now we wanna do the softening. This is the softening product. So just a little in the chin crease. You're doing great. I know it's a little pinch. We did a little on the folds. And she's gonna get a nice 9 to 12 month longevity with this. It's just gonna balance everything. All right, let's show her. So again, let me just reiterate to you guys, a little temple lifting, a lot of lateral contour, enhancement of the apple of the cheek, projection and softening of the chin itself, the crease and the folds, and a little lateral jawline contouring.
Oh, wow.
So what do you think now?
I think that you are amazing, and I'm so happy I came.
So
This is
here's the
great.
thing, balancing. You have nice here. We didn't do anything here. We just gave you more definition here, which it looks a little more projected now because there's injections and stuff, but it'll settle in. And a little lifting, so now when she smiles, it's all lifted up and balanced through the temple area. We gave you a little more angle there, so you'll be able to see that on the 90 degree. A little projection here, softening here, softening here. I think that's a good start. What do you think?
I freaking love you.
Love that, guys. So very happy Filler Friday. Have a good rest of the day.